A Charlotte mom and doctor says she almost died following childbirth, and she says she believes she did not get the right care because she is Black. CDC data shows Black women are 2 to 3 times more likely to die from pregnancy-related complications than white women, with most of the maternal deaths being preventable. That's why, as WCNC Charlotte's Michelle Bowden shows us, this woman is seeking solutions, starting a nonprofit to make sure Black women get the care they need.
Weebi, the women's empowerment and birth equity movement, grew out of one woman's brush with death and the realization that what happened to her was happening to others just like her. Janisa Brown's 7-year-old son was barely more than a week old when she didn't feel right.
10 days after I had him, I actually had a heart attack. All of a sudden started feeling this strange sensation in my chest.
A doctor herself, she acted quickly, heading to the ER.
What's even scarier is that I was initially misdiagnosed. The physician, even though he knew I was a physician, told me that maybe I was having a panic attack or maybe I was having heartburn.
An on-call cardiologist correctly recognized she was having a heart attack, rare for a 35-year-old woman, but something that can happen after giving birth. Brown had a spontaneous coronary artery dissection. Medicine and rehab meant a full recovery, but the experience got her thinking.
This is not just a conversation just about Black women. I think, we're in this position because, Black women are situated in they're a double minority, historically marginalized, but all women can understand this, that feeling of being dismissed and feeling like, someone's kind of blowing you off. And it really started to make me question, how I could best use my skills to impact the problem.
She went to Harvard, got a degree in public health, and went to work.
Came back to Charlotte actually trying to join a community organization who was doing the work that, I wanted to do. And there was just this little pocket that was not being served.
So in 2023, Brown founded Weebi, the Women's Empowerment and Birth Equity Institute. They work with women ages 15 to 65, trying to make sure they get the health care they need before, during, and after pregnancy. Tia Carruthers is a volunteer with Weebi because of her own birth experience.
In the moment, you don't really realize certain things are happening, but it's like as you look back, it's like, okay, that could have been handled differently.
She struggled with nursing as a new mom, but didn't really get the help she needed at the hospital.
Now I know there's so many resources out there that I could have tapped into that I didn't know at the time, which is why I think, Weebi is so important, is to really highlight those things that are available to women that you don't realize is there.
I really just came into this feeling like if I could help one woman not go through what I went through alone, that would be enough for me, and it feels very fulfilling. I'm just happy to be a part of the change, and change that people can feel, like that they can see.
Brown is hoping to grow the work they're doing by partnering with other area nonprofits. Reporting in Charlotte, Michelle Bowden, back to you.